If you've been having some difficulty hearing a normal conversation or even basic sound, you may want to turn up the volume for our next guest. Dr. Kristen Bish of Palmetto Audiology is here with details on how you can take a hearing aid test drive. And it's much simpler than you would think, so stop putting it off. Dr. Bish, thank you for joining us. Now, we were talking a little bit off air. I had some concerns. Been in radio for 23 years. My mom bought me my first headphones at like the age of 10. So I'm used to listening, to music in closed spaces and rather loud at times. So when should someone become concerned that they might have a hearing problem and they need to see an audiologist?
I would say as soon as they start having concerns about themselves, or more so their family having concerns. Sometimes you don't know you have a hearing loss, you don't know what you're missing because you're missing it.
Right.
So,
Right.
I would say that if your family has concerns or if you have concerns, it's a simple test.
Yeah.
It's covered by most insurances, Medicare, TRICARE. Most of the major HMOs will cover a hearing test.
Now, I know growing up, if many of you in my elementary school, every year we would get tested. They'd have someone come in and they'll put the little thing in. The little test. Has it changed much since then?
It really hasn't. We still use pure tones. We use a couple other tests that test the eardrum and they test the hair cells. But basically the test that you took in elementary school is the same type of test.
About the same. Well, that sounds pretty good. Now, let's talk about hearing aids. They've changed quite a bit over the years. Not so much noticeable, and you have small ones that now that you have the Flex trial. Tell us about that.
Yes, the Flex trial is something that we were chosen to do by one of our laboratories that we work with, Unitron. And what we can do with our patients is bring them in after their hearing test, and we determine that they are a candidate for hearing aids. We bring them in and put them in hearing devices that they can take home at no charge for a couple of weeks and test drive it in their own environment.
Wow. Okay.
When we put hearing aids on a patient traditionally, they're fit with them and they have to either file for the insurance or we have to get payment on the hearing aids right away. With the Flex trial, it's nice because we have these demonstration models that they take home with them for a couple of weeks to see if it's really truly going to help them. It helps to prove to them that hearing aids can help me.
Right, and it doesn't have to look quite so obvious because maybe some people might have some misconceptions that they're still bulky, and it's kind of embarrassing for some people, I think, especially if they're younger.
It is, absolutely, and we're fitting more and more younger patients every day.
When you say younger, what are we talking about?
I mean, we have pediatric patients that come into our office all the way up through, our senior citizens that we love so much. So, but there are quite a few of veterans or patients who've worked in noise who are in their 30s and 40s, and they do need a little bit of help that they otherwise couldn't get.
Now, do you find with something like that, when it comes to hearing loss, that it can get better, or the hearing aid just kind of helps maintain it, or how do you determine, do you always have to have a hearing aid once you've been diagnosed with some type of hearing loss?
Usually when it's a permanent type sensory neural hearing loss, it is permanent, and we use hearing devices more likely than not for the rest of their lives. There are some cases of temporary loss or conductive hearing loss that usually surgeries or medicine will help that patient, and we don't look down the avenue of hearing aids.
All right, well, you have a big event that's going to be coming up the 13th and 15th. Let everybody know all about it.
Okay, this week we are doing what's called a meet and greet, where we have appointment times available for you to come in and just feel very comfortable with meeting the audiologist and getting to know us as practitioners, and to make our patients more comfortable with their decision about treatment on their hearing loss.
Okay, and so do they have to make an appointment? Is there a number they need to call to register, or what should they do?
Yes, they should call the office just to make a time and know that we are available for them. Our
and you can see it on the screen right there?
Is, yes, 871-3235.
All right, so that hearing aid test drive, do it for yourself, do it for your family, because they're tired of repeating things, and they're tired of you just completely messing up what they just said. No, Mom, we did not say that. Dr. Bish, thank you so much.
Thank you for having me.
Stay with us. We're back in a moment.